we'll go on to the next name. We are recording this session, so please be advised that it is being recorded. If we do run out of time, we will ask that we'll try to capture the questions in the chat, or if you can reach out to Jill Burns, who is the person who sent out the invitation ahead of time with your follow-up questions, that's great, and we will collate them afterwards. This presentation will be recorded and accessible through Ottawa Public Health. We will also be sending out a PDF in English and French following the presentation. That's it for me. Thank you so much for joining, and I will hand it over to Jill.
Thanks, Alison. So we have 4 panelists with us today, and I'd just like to introduce them to you. So we have Dr. Sarah Funnell, an Associate Medical Officer of Health with Ottawa Public Health. She's facilitating the webinar today. We have Crystal Taylor behind the scenes. She's a senior nutritionist with the Ottawa Public Health and has been a member of the Human Needs Task Force of the Food Security Subcommittee. And she's been collaborating with the Ottawa Food Bank and our facilitator, Dr. Sarah Funnell, to bring this webinar to you. So thanks a lot, Crystal. Francine Somerville is with us also. She's with the City of Ottawa, and she's here on behalf of the Human Needs Task Force and her work as chair of the Food Security Subcommittee. Thank you, Francine. And last but by no means least, we have Alison Fitzgerald, who is the interim director of the Ottawa Food Bank Programs and Planning Department. I'm Jill Burns, not Rachel Wilson, as I'm sure most of you actually realize that. I'm the dietitian with the Ottawa Food Bank. Before we begin the presentation with Dr. Funnell, I'm going to put you into the hands of Francine Somerville, and she's going to take a couple of minutes to share some of the work that she's been doing with the Human Needs Task Force and the Food Security Subcommittee. Okay, over to you, Francine. Thank you.
Thank you, Jill. So as mentioned, I'm Francine Somerville, and I just wanted to give you a brief update on the Human Needs Task Force. Some of you may already be aware. So the Human Needs Task Force was implemented as part of the city's emergency management plan for the COVID-19 pandemic. And the purpose was to ensure timely and meaningful response to the emerging needs of the community, particularly for those most isolated, vulnerable, and marginalized. So this would include our groups like our seniors, those who are medically compromised, refugees and new immigrants, low-income families, homelessness, people who are facing homelessness, racialized populations, and our at-risk youth, and other groups that we definitely wanted to make sure we could support them during this time. Over the last 5 to 6 months, the HNTF has worked in 3 particular subgroups. This was our homelessness and sheltering subgroup, outreach and social services, and our food security group. We've seen many accomplishments over the last 5 to 6 months in several key areas in serving and supporting the community. Our subgroups were supported by city staff and community agencies and service providers. So many of you that are probably on the call today were involved in these subgroups and supporting the work that's been done, and a lot of amazing things have been done over the last few months in such a short amount of time. And the main work has really been collaborating through the tables, through different conversations, helping to meet some of the urgent priorities that have popped up just through the outbreak and through the pandemic, and looking at how we can coordinate and collaborate at different levels and meet the needs that are more immediate, but also looking at how we can work with resources, coordinate at that level, and look at what's required in the immediate, interim, and long-term response for the city's most vulnerable. So really focusing at the ground level, but also focusing what's needed to move forward. So as we are still in that state of emergency, looking at it phase by phase. I did have the opportunity to chair 2 of these subcommittees, the Outreach and Social Services Subcommittee, as well as Food Security since April, and work with many of you in different capacities. We've accomplished much throughout the last few months, and really looking at a number of barriers in that short period of time, and looking at also what we're able to look at as far as solutions and also potential actions to move forward. the food security subgroup in particular, we looked at different urgent priorities, gaps, issues impacting food insecurity within the food sector and the system that was really further stressed throughout the pandemic. A lot of immediate issues and solutions that were presented as a group. We were able to really focus on what immediate asks were the table needed to focus on, whether it was rounding up volunteers, looking at PPE and masks, delivering fresh or prepared foods, getting information into the right hands. So a lot of coordinating of information packets to go out in various languages. It could have been getting it into particular sectors within various neighborhoods, and just really focusing on who needed to get what at what particular time. So a lot of it, as well as looking at a lot of the unknowns. So with the pandemic, was really focusing on that piece. So just again, kudos to those who were working with us on these subgroups. It was very stressful at times, but just getting to where we are today, we have a lot to reflect on and looking at the lessons learned. This webinar, again, was one of the products of our subgroup and collaborating and looking at what's needed to plan and go forward. A lot of complex and overlapping needs as well coming out of the table, and working, and I think an opportunity to work at a different level, coordinating across the sector with different agencies, having to really think hard and dig deep into different areas. So different opportunity to think of what's needed to move forward. So with the HNTF, there are a lot of accomplishments that I could sit here and talk about, but I know that's not the point of today. But the remainder of 2020, the HNTF will focus on transitioning. So there will be some changes in terms of players and what the next steps are. But the focus until at least the end of the year will be on priorities for winter and fall. So this is one of the topics for today, and service resumption and long-term planning. So if you do have any questions, I'll be happy to see what I can answer for you today, or bring them back as well, and do some further follow-up at the end of the session. And there's also a link on the PowerPoint to the HNTF webpage on ottawa.ca. So you'll have that resource to help you out as well. So thank you.
Thanks, Francine. It's great, great work. I'm going to hand it over to Dr. Fennell now.
Takes a while to click around, but I think I've found my way here. I just want to start by acknowledging that this beautiful community we live in is on the unceded traditional territory of the Algonquin people. This is a group of people which I identify with. I'm also Algonquin. And in recognizing that the Algonquin people have protected this land for time immemorial, and understand the importance of our natural environment and the role that the natural environment plays on food security. In addition, you know, we understand, and I'm sure all of you understand, the great importance of culturally appropriate foods and the role that plays into a definition of food security that recognizes the importance of culture. And I also wanted to let you know that, you know, I woke up this morning feeling really grateful, as I have many mornings during the pandemic, that I have the privilege to live, work, love, and play in this great city with great people like you that have come together in an unprecedented time. Oh, I'm supposed to show you, I think, my next slide, which I can't do right now. This one. This unprecedented time where we have never seen anything like this before, and the way all of our partners came together in a way that I think is largely unrecognized by the greater community. You quietly did your best to ensure that those that needed housing, shelter, food, masks, PPE, that they got it. So I agree with Francine, huge kudos to all of you. We often hear about the heroes in this pandemic, and that's the frontline healthcare workers. No doubt they make sacrifices all the time. But there's also unrecognized heroes like yourselves that did this work without looking for pats on the backs or big signs, you know, on the side of buildings. You did it because you knew how important food security was to the health of all of the people in Ottawa. So a huge kudos to you. I'm an associate medical officer of health at Ottawa Public Health. I also practice primary care in Indigenous communities as a family physician. And my role in the pandemic has been to support our case and contact management team. And when we had situations where we were asking entire families, low-income families, to not leave their houses, it was you that made that possible. I call that supportive isolation, where it's the community that supports families that need it most. And I've been reflecting a lot over the course of the pandemic on this term that we call vulnerable or protecting vulnerable. And I have this great colleague, her name is Dr. Marcia Anderson, that says, I'm not going to use that term anymore, vulnerable people, because it's actually the term that we should be using is more populations that we systematically leave out. And so we think about those structures that are in place that systematically leave some people of our population out, and that's racialized communities and Indigenous communities and others that are othered. And so in the course of this pandemic, what we've seen is that it's illuminated the inequities in our community. And again, I can't stress the importance that the role you've played in providing a stopgap in that, so that we could protect our community. The work that you did allowed people to self-isolate, and that protected our community, it protected all of us. So thank you for that. I just, I mean, we could spend the whole 50 minutes, I could thank you over and over again. But I've been asked to do other things. So I want to also acknowledge the important role that Crystal has played at OPH in terms of the Human Needs Task Force and the Food Security Committee, and also in preparing me for this presentation and these slides. So what we wanted to do is talk a little bit about infection prevention and control practices, some COVID control measures, review some strategies for adapting indoor programs. We've got some cool models, so thanks to those who provided those, and discuss common scenarios and challenges. And I may turn to Crystal at points to help. So I want to start by letting you know that we do, this is an unprecedented time. There's many challenges. And some of those challenges are that province makes decisions in a top-down model. That's why we have government bodies. And sometimes we're not given a lot of notice about changes that are coming. So we do our best. Since reopening, we've had many more social interactions, which has increased the risk of transmission. And so there's a need for businesses to proceed with caution. Just because we're permitted by the government to have gatherings indoors of 50 that doesn't mean that's the safest thing to do. Similarly to outdoor gatherings. It doesn't necessarily mean that's the safest thing to do. We're encouraged to have a social bubble of no more than 10. Well, sometimes that's actually not the safest thing to do either. And so as we go into this, the fall and winter, we have to keep that in mind. And despite the allowances under the emergency measures of these larger gatherings, social bubbles, there's still no such thing as zero risk. And so we need to focus on reopening as safely as possible. So what we like to do as a local public health entity is to provide our community partners the best possible safest advice we can give, knowing that, humbly acknowledging that we don't fully grasp all the challenges that our community partners face in their frontline service. But we provide the best advice we can do and recognize that often it has to be adapted. We often get, we get lots of inquiries from the community asking various questions, but simply stated here, these recommendations here, the COVID-wise recommendations, can apply in every setting. Wearing a mask, isolating yourself when you're sick, keeping that physical distance, exercising proper hand hygiene. These are, in the absence of a vaccine and the absence of treatment for COVID, it's really what we call these non-pharmaceutical interventions. COVID is super sneaky. COVID sneaks in to a susceptible group, which is basically all of us, when we're crowded indoors, whether that's a living situation or a work situation or a social gathering. And it can do that outdoors as well. We know that outdoors is safer, but if you're close and you're in a large group outdoors, COVID can spread rapidly. COVID is also sneaky in that it sneaks into these scenarios in ways where we don't recognize it. So even the slightest sniffle in anyone could be COVID. Not to instill fear, what I'm saying is that that's why these measures are so important. Anything you can do to block COVID, as you know, COVID is spread by droplets when someone coughs, sneezes, speaks, sings, yells. And so anything you can do to block it will keep people safe. So blocking is distance, masks, staying home when you're sick, and washing your hands and not touching your face. So these are the general infection prevention and control measures. So wearing masks, what we know about masks is that if the entire population wears masks, we will have fewer cases and fewer deaths. The studies from other countries show us that. It's super important to wear masks. There are some exceptions to those that can wear masks. And so we're also trying to instill this idea of kindness in our community, that not all people can wear masks. Young children are not advised to wear masks for various reasons. And there are some medical conditions where people are not able to wear masks. And so we're not asking anyone to be the mask police, but to encourage those to wear masks. And we have some resources for you to help that, and you probably already have them. And people forget. I went into the store the other day to buy milk and eggs, and I had my mask in my hand and not on my face. I was distracted. And the store clerk said, "Ma'am, please put your mask on." And I said, "Oh, yes, of course." So they asked me with complete kindness. So we do have our temporary mandatory mask bylaw, which I'm very hopeful is going to make a difference in terms of transmission within our community. What we do know is that the majority of people in our community, through our polling, do wear masks at indoor enclosed public spaces. And I like to encourage leaders in the community to wear masks as much as possible, so that we can set examples for others. So we do have this mask mandatory bylaw. Again, those exceptions. So children under 2, some medical conditions, and so just to keep that in mind. Of course, it's not possible to wear a mask if you're eating. So that's obviously not required. There, again, like that, putting a barrier in between droplets is really important. So in some cases, if a staff is behind plexiglass, that does limit spread of droplets. Of course, what I'm seeing in the community, and I'm happy to see, although it makes it hard to hear people, is people wearing masks and being behind plexiglass. I'll tell you why that's important. What we know from our experience so far in the pandemic is that it's more so when you're with your coworkers or your friends where you're likely to become infected with COVID. And less likely from an interaction with a client that's behind plexiglass. So when you see, I went to the coffee shop earlier today and I saw, people crossing and they were wearing masks. The employees were protecting each other as well as protecting themselves and protecting their clients. Super excited about the work that we do at Ottawa Public Health, and I hear it from a lot of community members that we're doing a great job in terms of our resources to the community. So we do have our mandatory mask poster in multiple languages, so please feel free to use that at will. We do have some videos as well, as, and again, that's for your use. Another basic important principle is to isolate yourself when you're sick. As we're reopening schools, now is not the time to send children to school with little sniffles. Now is not the time to grin and bear it and go to work sick. We used to, even as a physician, there were times in the past where I went to work sick, and now is definitely not the time to do that. So we encourage ourselves and the others around us to stay home when you're sick. The other important aspect of reducing the transmission of COVID is through screening. So ensuring that all your employees, volunteers, and clients are well and fit to work or volunteer prior to coming to work. So that's done through screening, daily screening with a symptom check. Some employers in particular healthcare situations will even measure temperature. And so asking, ensuring that your volunteers have not traveled in the last 2 weeks out of the country or been around others that are sick. So this is, so as I'm speaking, you can see that it's really going to require multiple strategies in order to reduce transmission, and screening is an important part of that. So that's for your employees, volunteers, staff, but also encouraging clients not to access your services if they are symptomatic, which is why the Human Needs Task Force is so important in that outreach to those that can't access services in various locations. The Human Needs Task Force is going to continue to be important as we go into winter and fall. I can guarantee it. The other aspect of helping us do our work in contact tracing. So you're likely aware that at Ottawa Public Health, every single case of every single person that's diagnosed with COVID, we follow. We follow them for at least 14 days, sometimes longer. We ensure that they stay at home and that they self-isolate. And we also follow their contacts, their household contacts, and their contacts in the community, and their work contacts. So you can imagine with the numbers of cases of coronavirus we have at this time, and with reopening, the number of contacts that our team calls every day is in the hundreds. And so to assist us in contact tracing, if you can keep track of who's accessing your services at what times and when, and who they interacted with in terms of your staff and volunteers, this helps us incredibly. I can't stress that enough. Decreasing time and energy, and not to mention, as soon as we can identify contacts, the sooner the better, so we can let them know that they should stay home. So we do have some sample logs on our website that you can use if you don't have your own. Another interesting and important evolution in our pandemic response has been the COVID Alert app. And so if you're not aware of it, you can download it on your smartphone. It will ping you if you've been exposed to someone with COVID in the last 14 days. And so we have just in the last couple of weeks had our first case identified through the COVID Alert app, which shows us that it worked, at least at this so far. So there was an individual who had the COVID Alert app on their phone. They got alerted. They went for testing and found out that they were actually, in fact, infected with COVID. And so we were able to rapidly identify that person and follow them, and then notify their contacts. So this is free for everyone. It's a federal app, and we're encouraging its use. It assists us in the work that we do. As you can see, as I continue, it does require all types of different interventions to decrease the transmission of this super sneaky virus. Distance, again, is really important. We know the droplets travel approximately 2 meters. And so a distance greater than that is what we recommend. And you may have been hearing there's been differences around the globe, changing the number to less than 2. I haven't heard any changes here in Canada or the province of Ontario. We're sticking with 2 meters. It might be because a hockey stick is that long. No, not sure. So again, we have signage for that. I've seen, I mean, anywhere you walk in the community, there's stickers on the ground, spray paint, what have you, anything that can simply remind people. It certainly reminded me at times that, that I need to take a step back myself. So this is the fun and creative part. Preparing your physical space for those that provide frontline service, and we do have some examples coming up. But you can see, and I'm sure in where you've gone in the community, you know, there's arrows. So we have one direction, so people aren't meeting each other face to face. Those are the directional arrows. There are ways to physically arrange your environment to discourage gatherings. So rearranging equipment. Here in our city departments, we do have areas where you can see all the extra chairs have been shoved away so people can't sit closely to each other. And now might be the time to invest in plastics. Plexiglass is popping up everywhere, and I wish I'd thought of that earlier on in the pandemic. But that there's lots of creative ways to put blocks in front of the COVID droplets so they can't get to others. So we've looked at some indoor dining. I'm a mother of 3 children. I don't tend to dine too often outside the house, but I have seen some very interesting things out there, limiting the number of people per table, including keeping tables far apart from each other and discouraging mixing between tables. Buffets are not permitted at this time. And so self-serve locations where people can gather and touch each other and touch the same items are discouraged. So not only is COVID spread through droplets of person to person, but it is also spread from when, if I put this pen in my mouth and then lent it to my neighbor, it's spread that way as well through objects. So, which is why, only having one person use an item limits the spread as well. So that's a single serving type of items. And then if you don't have that, ensure that you are cleaning and sanitizing between uses. So I am going to ask whoever submitted this photo to speak to it. Would that be okay? Crystal, are you there? Are you prepared?
Sure, I can certainly speak to this. So
Okay.
Thank you to the Shepherds of Good Hope for submitting this picture. And really they showed that they're starting to look at how to offer indoor dining services. And you can see some of the challenges. The tables and chairs are stuck to the ground. They're close together. There's the servery on the left side of the picture, possibly where people may gather. I'm not sure if in that situation, some clients may have served themselves, but moving forward, that would be best if there was somebody serving that food. So that's really just to give an example, and we can't tell from this picture if there's more than one entrance, but to kind of keep in mind like that directional arrows if you only have one entrance, what you need to do. And then they shared the next picture on the next slide is what they're proposing to do. And so this is like the floor map, and each of the red lines, I believe, are plexiglass. And you can see that only half of the chairs, I think, will be permitted for individuals to sit at. So that was, this is one example of both keeping that distance, limiting total numbers of people. Some other examples, we would really encourage that the clients would have their mask on all the way until they're sitting at the table. And then mapping out some arrows along that serving line so that people are moving along in one direction and would have one person or per serving station. But I don't know if you had any other ideas, Sarah, just or if that's on what else could be done in that situation.
Crystal, I think it looks good, and I'm happy to see it being thought out so carefully. So as long as people can keep a distance and not intermix, like the fewer close contact interactions without wearing a mask are really important. I think one of the challenges I've heard, and we can validate this on this call, is the access to masks. I have seen homeless people turned away from stores because they don't have masks. And I do have a young child, well, I have 3, but my youngest is 9. She has a huge heart. And so what she what we did was we have handed out masks to people that need them, and so as a stopgap measure and to help fill her little heart, but ensuring that we have access to masks, I think, would be something important, and would be happy to hear from you if that's a challenge that you've experienced with your clients. Of course, looking at this space, it would be hard to imagine that 50 people could congregate in this space, demonstrated in the previous slides. But that is a gathering limit, and knowing the increased demand on your services due to financial pressures, I can see that your gathering limits, or the demand for your services has probably increased. But like I said before, just because the limit is 50, that doesn't mean it's safe. So you do have to take into consideration the size of the space, and that if people can maintain that physical distance. Again, a max of 100 people outdoors may not be safe either. So these are provincial numbers. Ottawa is a special community. We have over 1 million people, including if you include Gatineau, and we have a rate of COVID infection that makes me think these numbers aren't safe for our community. So fewer people gathered indoor, the better. So we can troubleshoot with you how to manage the demands on your services. So of course, exercising proper hand hygiene is really important. And I've been noticing when I walk around in the community that if there are hand sanitizing stations near doorways or going into stores, I'm definitely more likely to exercise hand hygiene. And so making sure that that's visible and that there's prompts for people to use. I particularly appreciate when there's not only a hand hygiene station, but a mask available for people at the same spot. So of course, I'm sure you've seen these promotional materials before on how to ensure proper hand hygiene. So we do have some references for environmental cleaning. And it's important to clean surfaces and disinfect them because of that transmission with objects if someone is sick and then an object is left uncleaned. Not only are these great ways to reduce the spread of COVID, but all kinds of other respiratory and enteric illnesses that we see in the wintertime. So influenza and other diarrheal illnesses. So I'm sure that those of you that do this frontline service work are well familiar with cleaning guidance. So again, those general considerations, it's being COVID wise, it doesn't have to be too complicated. You just have to think, how can I block COVID, that sneaky virus? Reducing risk for picking up food. So I'm not sure that that all of this will be applicable. Again, we humbly recognize that you know your clients best, and that arranging appointment times or specific times may not be in the realm of possibility for some of your clients, but if it is, for some, it could help. And picking up food, I'm sure you've seen lots of ways to do that in the community. I've seen one place near where I live where there's bags of food left out and people can come and pick them up, and there's no person-to-person interaction. And so that's one consideration. One of the shelters has also managed to serve food in a way that a pickup, you know, a brown bag type of meal is available. And cleaning and disinfecting is super important. Of course, hand hygiene. And then inevitably, you're going to have lineups, and to figure out a way to support your clients in ensuring that they maintain that distance is really important. So again, you can see that it's really those simple COVID-wise measures that are going to protect your staff and your clients from increased transmission of COVID. And all of this on top of our usual safe food handling. But they go hand in hand, so. So in summary, it's important to apply those COVID-wise principles. I'd be interested to hear from you how relevant they are to your clients and your volunteers. And there are some additional guidance for shopping in grocery stores and grocery stores. Thanks to Crystal and the team for that. Again, this looks like a picture of the food bank, and I will hand it over to Crystal, who's done lots of work with the food bank in the past to help me describe this picture.
Sure, thanks, Sarah. This is Morrison Gardens Food Bank, and they've been offering a hamper service so far, and I'm assuming outdoor or right at the door pickup, and are looking to consider how to give clients more choice on what they're choosing and coming indoors for the colder weather. So just to show some of these spaces and to reiterate how those COVID-wise principles could be put in place again, in terms of all the same measures that we talked of. The space is quite limited, so the numbers would need to be limited. It may actually be limited just to one household at a time. That could, if they were going to have some choice and shop right from the shelves, or perhaps a staff or volunteer member is standing there and that table gets turned at almost like a counter where the clients could see, and one staff member is taking the items and putting it in a box, for example, or taking the items out of the fridge, would reduce the number of total contacts. Again, need to be wearing masks indoors and having hand sanitizer available at all entrances, or if maybe continuing to offer that hamper program ongoing, if that is what's working now and is more feasible. But just want to say thanks for offering all these practical examples.
Yes, and then looking at this this picture of how the table's been turned, and thinking that there could be a service provider getting the items for the client, I could also see the role of a plexiglass barrier there as well for additional protection and blockage of any droplets. And then Crystal has prepared this information for community cooking groups. Of course, limiting the gathering sizes of any events such as that certainly would be beneficial. Physical distancing, mask wearing, plexiglass, not sharing food in that family style, unfortunately, where you're reaching into the same bowl or serving yourself from the same pot. And of course, as always, following safe food handling procedures. Again, it would be interesting to hear from you what your experiences are in these types of activities. Communication is really important. I think, again, I'd be really interested to hear from this group if the type of messaging you're hearing from me is frightening you or empowering you, because what we want it to be is empowering, that you feel the power to be able to keep yourself and your clients safe. And so the type of communication that we want to use is in that way empowering, and allowing you to be able to make a healthy choice, the easiest choice. And ways that we do that, of course, are by having hand washing available to you where it's easy to access, reminders, visual reminders to do those things, having access to masks, again, with some visual reminders, and those types of things. And making sure that your clients are aware of the risks, any sort of group activities that you're doing, but not in a way that scares them, of course, but that they are recognizing that all the activities that we have at this moment, unfortunately, come with some risk, and that sometimes we have to accept that risk for the benefit of being together, for that social interaction, or even just accessing food that we need, healthy food. And so it's important that we balance the risks with the benefits of being together and eating together. So we do have several resources for you on our website, and a previous webinar that we did in August with the Ottawa Board of Trade that you can take a look at. Feel free to provide some feedback to me on that one. Lots of resources. Again, I can't stress enough my gratitude to our partners at the Human Needs Task Force. It's really been incredible working with different partners on ensuring that the people that need it most get the services that they need. And I think, unfortunately, there's no end to that type of work that we need at this time. And I can see that going forward into the fall and winter, we'll need to continue providing human needs task force services to our community. So many resources, multilingual posters, videos. Please give us feedback on these, and we need to hear from our community partners if we're getting it right. I think I'll stop talking. I'd love to hear from you. I don't know how we are for time.
I will do a very quick thank you. That was incredible information and lots of it and some amazing links. So thank you so very much to Human Needs Task Force, Ottawa Public Health, and Dr. Sarah Funnell. We have only about 4 minutes. We could probably fit in a couple of quick questions. If you want to type your name into the side, we'll give it a go. You can unmute yourself. Or if I think Jill's being a pro over here, and if she sees your hand up, she'll unmute you and you can ask. We also, please do not hesitate to reach out with further questions to Jill, and we will try and find the answers for you. We work closely with Crystal, who can ask Dr. Funnell when she gets a chance, which is pretty quickly. So I'll leave it.
And again, any feedback on our resources or what your experience is, we want to hear about that. We want to hear from our community partners the challenges that you face, so we're appropriately messaging and supporting you.
Sylvie, I've unmuted you. Sorry.
Sylvie appears to still be muted. No, maybe not. But thank you, Christine. Our hope is to empower you, not to instill fear. Thank you for that feedback.
Hi, it's Rhonda. Can you hear me?
We can hear you, Rhonda. Yep.
Okay,
Yes,
perfect.
we can.
I just wanted to thank you for the person who shared their the photos of their food bank. We're in a similar situation, so we did just start doing our in-person food bank. We've done 2 rounds of distribution now, and it's all outside. But we do have our food in hampers, and similar to that photograph. So we also have those same concerns about how we're going to move when the colder weather comes. So perhaps, you know, it made me realize we're not the only people in that position. And I'm wondering if there's a way for us to connect with one another about like what our plans are for winter, and maybe we could help support each other to move into what a COVID winter in-person food bank would look like. So I work for Tunkasuminga Inuit. So anyway, just wanted to throw that out there.
I can take that one, Rhonda. Hi, it's Allison. We would be happy to try and facilitate some conversations between food banks, especially in similar situations. So if you as food banks would love to share or reach out, please email me and I'll try to start making some connections to help work through this. That's great. Thanks, Rhonda.
Thank you.
That's a great idea, Rhonda. I'm so glad you're here today. Thanks for joining us. I'm a big fan of the services at TI, so it's great that you were able to join us. I think that as a local public health unit, we can provide the best advice we can give, but we don't know your clients like you do and what your needs are. So as much as you can gather together and troubleshoot, and let us know if you have any questions or concerns, and we'll try our best to answer them so we can meet your unique needs.
Erin, I think you can unmute yourself. Are you able to, Erin? If you hover over your picture, up in the top right corner, there's an unmute button.
If Erin would like to type her question into the chat, we can try to answer it that way. Very rudimentary Chromebook. I know my child has a Chromebook and I cannot figure out how to use the keyboard. Okay, well that was easy.
Next I have Bonnie McCutcheon. If you want to...
Hi there.
Sorry, it looked like Erin didn't have a question but wanted to share what she's been doing. So Bonnie can ask her question and Erin can share all at the same time.
Wonderful. My name is Bonnie McCutcheon. I'm a health promoter at Carlington Community Health Center. And we've been doing a community kitchen in Westboro Beach for the Van Lang community for many years. Recently, we switched to a delivery model, but we're hoping to get back into cooking with just a few volunteers and then having residents come pick up their food. But one thing we're struggling with is the volunteers who are coming, the nose is often out of the mask. So like sometimes it's like a mask fitting issue. So we try to give them a different mask or, you know, do a twist of that. But I find the nose often comes up, which is difficult. And then I was wondering if you had any advice on how to do physical distancing while cooking. Because that can be difficult. So I know all the restaurants in Ottawa are open, so they are doing it. So it's just perhaps a lack of my understanding.
Thanks for the question. That's a great question. I think having an idea of what your space looks like would be helpful to understand what the needs are. But you know, you could look at having stations where someone does the prepping, someone does the cooking, and someone does the serving, and looking at creative ways to do that. In terms of masks, you're right, we certainly do see a lot of people in the community wearing masks with their nose exposed or on their chins or on their heads. And so we do have a video on our website on how to properly put on and take off a mask. So so that's super important. So thanks for highlighting that. Again, how to cook together and maintain a distance is certainly a tricky one that I wish I had a really good answer for. I don't know if Crystal's come across this at all.
No, not particularly. And I think your reference to restaurants is important. In some scenarios, they are distanced, and in others, they aren't. And that's really the setup of some of the commercial kitchens, and why it's so essential to be wearing the masks and the hand hygiene. In some of these professional settings, they may have put plexiglass between the stations if they can't maintain that distance. But the more layers of protection, as Sarah has shared, the better. And if it's a community group setting, I think we would want to make sure that you can have that distance before doing that.
We don't have any more questions that people would like to share at this time. So again, please do not hesitate to reach out, and we will point the question in the direction we can give you the best answer. We'll also look to create a troubleshooting sharing session for those interested. The more information we can share about best practices, the better. Thanks again, Dr. Sarah Funnell, for all that excellent information. Human Needs Task Force for doing what you're doing. We really appreciate being a part of that and helping inform the city and getting the right food to the right people as best we can. And we shall call it a day on this Friday afternoon. So thanks very much. I hope everybody has a wonderful weekend, and we appreciate you being here. Take care.
Thank you all. Bye.